Hello, Matthew. How are you?
I'm good. How are you?
I'm great, thank you. So, how long have you been a vegan for?
Almost 15 years, about 14 and a half.
Really?
Yeah.
That's a long time. So, what made you go vegan?
Initially, it was for more health reasons. I started to make a shift towards more plant-based diet, and I did feel better, and I was losing some weight, and skin was clearing up, and all of that. And that's what got me interested in nutrition in the first place. And over the next couple years, I started to learn more and more, and eventually made the swap to 100% plant-based around the time that I also ended up watching Earthlings, which brought in the ethical component.
You are a doctor, so tell us, what kind of doctor are you?
I'm a naturopathic doctor, so I focus a lot on nutrition and lifestyle in my practice in addition to medicine.
So many people have this misconception that a vegan diet is not adequate. So, what do you have to say on that?
A vegan diet can certainly be adequate. Every dietary pattern has certain nutrients that they tend to be more rich in and certain ones that might be areas of concern. And so you just need to place a little bit of focus on certain things. So with a vegan diet, you want to focus more on vitamin B12, maybe vitamin D. But on a more animal-based diet, sometimes fiber is an area that needs to be focused on, potentially even magnesium or folate. So it just depends on what sort of foods you're emphasizing in your diet and where you need to place your focus.
So, a lot of people have this misconception that if they eat animals, they don't have to take supplement. Is that true?
It could be true. It depends on the overall dietary pattern. So in a lot of cases, people still need to be concerned with, as I mentioned, folic acid or folate rather. In some cases, vitamin D. In some cases, iodine. It really depends on the overall dietary pattern. Just including animal products doesn't all of a sudden cover you, right? And on the vegan diet, it's the sort of opposite, where you tend to get a lot of folate, you tend to get a lot of fiber, but then you need to focus more on things like B12.
Do you think there are any health benefits when you go vegan?
Oh, absolutely. When we look at the research, such as the Adventist Health Study 2 or the Epic Oxford Study, we see that vegans and vegetarians actually tend to do much better for cardiovascular health, for diabetes risk, for cancer risk compared to meat eaters. And this even includes relatively healthy meat eaters. Now, that's not to say that going vegan or 100% plant-based is necessarily going to be better than 90 or 95% plant-based. But what we can say with a pretty high degree of certainty is that adopting a predominantly plant to plant-exclusive diet can be beneficial compared to a more omnivorous diet.
So, a lot of people think that a plant based diet is inadequate for getting protein and it doesn't have all the essential amino acids. So, what do you have to say on that?
Well, all plant foods contain all the 9 essential amino acids, so that's not a problem. Now, certain foods might have less of one amino acid, but more of others, and so it's just important to eat some variety in the diet. Don't eat just one food as your entire diet. And now, on top of that, you can certainly get really protein-rich plant foods. For example, tofu is quite rich in protein, and per calorie provides about the same amount of protein as your standard 80% lean beef. And then foods like seitan, which are wheat-based proteins, or textured vegetable protein, which is soy where much of the fat has been removed, so it's more concentrated. Those match even extra lean meats. So you can certainly get a lot of protein from many plant foods. It just depends on what you're focusing on. So I wouldn't rely on, rice for your protein in that case.
Right. You went vegan in 2010. So, what do you think has changed from then and now? And do you think it's easier to be a vegan now?
Yeah, so it was actually beginning of 2011. But yeah, I think it's so much easier now. I look back at my days there in university where, for one, I was sort of the lonely vegan in my group, and I had very limited options on campus for food. There was one cafe that I frequented in town that had a lot of good options. But other than that, there wasn't much. And now when I go back to that same city where I went to university, I mean, it's everywhere. There's actually a number of fully vegan restaurants, and then there's also vegan options at basically every other restaurant. So we are spoiled for choice here, and especially while being here in the UK, it's wild to me how many options there are.
So, what is the fallacy you hear often?
The appeal to nature fallacy. So a lot of people say, oh, but you need to supplement B12, therefore it's unnatural. And my response to that is, who cares? If we have research showing that a plant-based diet with, say, a B12 supplement is healthy, and in fact healthier than a typical omnivorous diet, what is the problem with that? You just make sure that you take that supplement. Whether or not something is natural doesn't necessarily mean it's good. Arsenic is natural, mercury is natural, but I wouldn't recommend ingesting those because they're natural.
Poison, any sort of poison.
Yeah, exactly.
Yeah.
Many of them, yeah.
So, do you think you can be healthy while supplementing yourself and going for foods that are highly processed?
Yeah, I mean, we have research on certain processed foods. Now, there's a huge variety of foods that would be considered ultra processed. You have, sausages, animal-based sausages. You have Coca-Cola and other sodas. But then you also have whole grain cereals, whole grain breads. Those tend to be healthy options. And things like plant-based meats tend to be somewhere in the middle, closer to the healthy side as well. So there are definitely plenty of options out there.
People have a lot of misconceptions about soy, so what do you have to say on that?
We have plenty of clinical trials now. We have dozens of randomized controlled trials in both men and women, suggesting that there's no meaningful impact on hormone levels. We actually see that soy consumption may lower the risk of breast cancer rather than increase it, as many believe, simply because the phytoestrogens in soy, the receptors that they prefer to bind to in breast tissue, are actually anti-estrogenic. So they can actually do the opposite of what estrogen would do, which is sort of ironic given the prevalent narrative out there.